We're back now, 8:35 with your health. And this morning, the 3 signs women should not ignore when we're busy, taking care of our families, taking care of work, taking care of everything in between. Sometimes we put off caring for our own needs. But when it comes to health, it's really important that you put yourself first. NBC News medical contributor Dr. Natalie Azar joins us now. Dr. Azar, we are busy. We do put our kids first, our work, our husbands, our spouses, all that stuff goes ahead. Because I think sometimes when we feel a little something that isn't right, we think, this will pass, no biggie, just wait a few days.
Right, and that's actually not incorrect a lot of the time, Hoda. And I think it's important for women to understand that there's no, like, duration of a symptom that automatically makes it a red flag. I would say maybe other than crushing chest pain, elephant on my chest, some things can wait. And then also there are very benign explanations for a lot of things, as well as more serious explanations for a lot of things. And the last message, Hoda, listen to your bodies, ladies, right? We get gaslit a lot. We know this in the doctor's office. If you feel like something isn't right, please get it investigated until you get your questions answered.
Shortness of breath. Now, some people walk up the stairs and go, oh, I'm feeling a little winded. This is unusual for me. I usually can walk up fine. When should you check it out?
Right, Hoda, and you basically hit the nail on the head there. If it's a change from your pattern, it's something to take into consideration. I always put, like, deconditioning is up there as something, but that's a diagnosis of exclusion, right? You just haven't been working out. So look at these 3. We have, obviously, I think it's intuitive, shortness of breath comes from the lungs. Could be asthma, pneumonia. If it's very acute, with chest pain when you take a deep breath in, blood clot, COPD, and COVID is now on every list.
COVID's on that list?
COVID's on that list for shortness of breath. And Hoda, one thing that's really important, you think shortness of breath, you think the lung, not always, especially for women. You've got to think about something coming from the heart, such as a heart attack, heart failure, even an arrhythmia. So if you're having shortness of breath that is persisting, you also need to rule out that it's not cardiac in origin.
So, when you say persisting, what does that mean? Should I go to the doctor? I know we're going to get onto another one, but should we go to the doctor right away, or what should you do?
You know, for most of us in medicine, shortness of breath and chest pain are 2 sort of red flag symptoms that if you're triaging someone, better to be safe than sorry. Maybe you have a new allergy and you have some asthma, and that's not acute, but you don't know that. Right? What if it is a blood clot?
This is interesting. Jaw pain. Like sometimes you feel like it's stress related, no biggie.
So a lot of things I think, are pretty intuitive. The TMJ, that's the joint that connects the jawbone to the skull, grinding your teeth can cause that. You can get arthritis in this joint. I want to highlight 2 of these. There are vascular problems, and people who are over the age of 50, jaw pain about 30 seconds into chewing could actually indicate a serious inflammatory condition of the blood vessels. You have salivary gland disorders. Think mumps, right? There's also autoimmune diseases like Sjogren's that can present with swelling of a parotid gland. Heart attack, jaw pain. For women especially, it doesn't always present with chest pain. We talk about that a lot. But you can have pain that radiates to the jaw or down the arm. So again, ladies out there, if you're having unexplained left-sided jaw pain, better to be safe than sorry. And then there's nerve pain. Maybe you had shingles and you have some neuralgia or nerve pain after that. Or there's also something called trigeminal neuralgia, really uncomfortable, that can cause facial pain, something that can be diagnosed and treated.
All right, don't ignore that. All right, so this one I think is going to hit a lot of women.
Oh, boy.
Frequent fatigue, which sounds like everybody all the time.
Everybody all the time, and I say this to my patients all the time. Fatigue is probably the most subjective complaint because fatigue can mean something different to everyone. I like the first 2 because these are usually pretty easy to diagnose and remedy when you have anemia, when you have thyroid disease. How important is depression, though? Fatigue happens to be one of the most significant symptoms. Fibromyalgia and chronic fatigue syndrome. And here again, Hoda, is where a really good history by your doctor asking you about pain, asking you about tolerance to exertion. And then, of course, we have chronic liver, kidney disease, and chronic lung disease. People often don't think that people who have pulmonary fibrosis or pulmonary hypertension, which are lung diseases, can present as fatigue. So the take home, listen to your body. A really good history taken by your doctor and some investigation usually can get to the bottom of most of these symptoms, usually very treatable and benign, sometimes can be more serious.
Dr. Azar, I appreciate that. Thank you so much.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.